Hi, I am Dr. Venkatesh. I'm a consultant neonatologist. Today I am teaching transient tachypnea of newborn. A transient tachypnea of newborn is a benign, self-limiting respiratory disorder seen in neonates born at any gestational age. The delay in the clearance of lung fluid is the cause for transient tachypnea of newborn. Usually it starts at birth and it lasts for about 6 to 8 hours. Sometimes the complete resolution happens in 2 to 3 days' time. We had a neonate born at 37 weeks of gestation, cried immediately after birth. His Apgar score was 7 and 8 at 1 and 5 minutes respectively. He developed respiratory distress since birth, hurried breathing, indrawing of chest, and grunting. He required 2 liters of oxygen to maintain the adequate saturation. His respiratory distress did not improve. He required CPAP. In the NICU, he was connected to CPAP. The ultrasound of chest was performed, demonstrated classical signs of TTNB. One, the double lung point, meaning there was a sharp demarcation between the relatively aerated lung and the confluent comet tails, indicating the pulmonary edema, the pleural wall thickening, and absent A lines. The chest X-ray was performed, which demonstrated the over-aeration of bilateral lung, mild cardiomegaly, the prominent horizontal fissure, the prominent vascular markings in the hilum, mimicking the sunburst appearance, and fluffy shadows in the lung. He required the CPAP therapy for 2 days, gradually taken off CPAP to room air. He did well. His respiratory distress settled. He saturated well on room air, sucked well on breast, and got discharged. So transient tachypnea of newborn, as I told you, is a self-limiting benign respiratory disorder, requires sometimes oxygen and also the CPAP, as we saw in our case. Rarely some babies, they require mechanical ventilation also. The transient tachypnea of newborn is also one of the important causes for pulmonary hypertension in neonate. Usually the radiological clearance will happen in 3 to 4 days time. Thank you so much.